Hi, this is Dr. Christy DeSafri, founding physician of Bone and Body Women's Health. Today I wanted to talk about hip fractures. So 3/4 of all hip fractures occur in women. This is staggering. And in fact, a woman's lifetime risk of a hip fracture is equal to a risk of breast cancer, ovarian cancer, and uterine cancer combined. Annually, more women die following a hip fracture than they do following breast cancer. And lastly, I think the statistic that is shocking is that we think about postmenopausal women. The incidence of hip fracture increases sharply as we age. So women 70 to 75 have higher rates, like on the order of 7 times higher rates of hip fractures than women in their 50 to 55 decade, which is only a couple short decades away. So this is why I advocate and why I really think it's so important at midlife, whenever that is for you, or whenever the time of menopause or menopause transition is, to understand your bone mineral density, do a bone health assessment, understand your bone strength, your bone density, and your bone quality, because we can take steps to prevent fractures. Again, prevent fractures like hip fractures and other fractures in our later decades of life. So important, again, to understand so we can make changes in things like our lifestyle, our medical history, our medicines, our potentially think about hormone therapy or estrogen receptor modulators or other medications that can reduce our risk of fracture and maintain bone strength and bone health. So really important when we think about the statistics, we really want to be changing and moving the needle. There's one fracture that occurs every 3 seconds worldwide. When we think about hip fractures and women living longer into their 80th and 90th decades of life, that translates to more hip fractures. So we need to be thinking now about prevention and now about treatment of low bone mass or even osteoporosis if you're at low risk for fracture, so we can prevent being these statistics. I hope to see you soon.